is Health Diary. My name is Gladys Gashanja, and according to a report done by the Global Burden of Disease in 2016, it said deaths caused by hepatitis surpassed those associated with HIV, malaria, and tuberculosis. 95% of those living with hepatitis don't even know they have this condition, which now increases the chances of passing it on and also not getting the right treatment and on time. So what is hepatitis? How is it affecting us as a country, and why? All those questions will be answered right after this fact of the matter. Hepatitis is commonly caused by a virus, and this is known as viral hepatitis. You can contract viral hepatitis through contact with the blood or body fluids of an infected person. The 5 main hepatitis viruses are hepatitis A, B, C, D, and E, with the common forms being hepatitis A, hepatitis B, and hepatitis C. The symptoms of hepatitis types A, B, and C may include fatigue, nausea, poor appetite, belly pain, a mild fever, or yellow skin or eyes. Symptoms of viral hepatitis are rarely noticeable, therefore many people are either misdiagnosed or do not come forward for testing.
My name is Mark Mbio. I am 38 years old. Going into treatment through the methadone, we went through some tests, and that's when now I found out that I had hepatitis. It had not reached a stage in which symptoms had started manifesting. However, when I was taken for scanning at the Aga Khan by Medicine du Monde, they said my liver had really been, had corroded, and there was like somewhat fatty. So that's when I, really freaked me out. For me, the biggest factors were sharing needles. I'm a recovering addict. I was just injecting heroin and popping Valiums. And though I tried to be very careful, friends, you try, and I tried to stick with the people who I would say grew up with, and I knew them, but in addiction, you really don't have friends, so that's where I got hepatitis from. One thing that was made very clear was the sharing of needles, but that I had already stopped. I had already stopped sharing needles, and basically something else that I was told was what I was eating, to be careful about, especially spicy stuff. There was a medication that I was put on, I think it was 3 months. But it was something that we had to do on a daily basis. I'm grateful for where I am, because I did find love. I have a son.
Oh, congratulations.
Yeah.
So some refer to it as a silent killer. We're talking about viral hepatitis. That conversation is what we would like to decipher, and to help me do that, we have BONIFACE NDIRANGU, who is a hepatitis C survivor, which is very good news, by the way, and Professor Elijah Songok, who is a virologist and Chief Research Officer at KEMRI. Gentlemen, thank you for joining me. Now, I'll start with you, Daktari. Deaths related to viral hepatitis have surpassed those caused by HIV and AIDS, by tuberculosis, and even malaria, but we do not see a lot of messaging around that. How come?
Yes, we're not having a lot of focus on that, because I think much more is that the issue has been that where it affects most, because the particular countries that has been our donors have really been confining much more the support to their countries, but they have not have that particular world view to be able to say that actually this is a national or global problem. But we think that's changing now, because I think 3 or 4 years ago, we had the World Health Assembly, and they said hepatitis should be included as one of the most dangerous emerging infections to be on the same rank with HIV, malaria, and TB. So we are seeing right now a change, but actually it was, could say, a more silent one, and it wasn't so much on top of the agenda. But I think as we are moving on, we are seeing as if right now there's that need, or there's that particular coming up to make it much more.
Okay, now only 5% of those with hepatitis actually even know they have it. So what about these symptoms makes it a silent killer?
Hepatitis A and hepatitis E are transmitted through contaminated food and water products. They often occur more like epidemics. So it's something which is ingested. If your immune system is good, sometimes they cause the infection, and then your immunity fights it, and you develop antibodies, and then you are safe. So mortality or death to hepatitis A and E is not as alarming as the other hepatitis, because majority of people fight it. The other two hepatitis right now, which is of great concern, is hepatitis B and hepatitis C. Hepatitis B and C are transmitted through contaminated blood products. They are transmitted sexually, and they are transmitted horizontally, that is mother-to-child transmission, or vertical to mother-to-child transmission. And for hepatitis B itself also, we have the issue that we think scarification is a more bigger problem, because it is more highly infectious than any other, even more highly infectious than HIV. So even a small drop of blood, somebody with hepatitis B, or even a small specification, or even you share, let's say shaving here, or piercing, will easily transmit it than the other hepatitis. Hepatitis C, we get it much more through injection drug users, injection. It has to be directly injected blood. So this is much more common among the people who are IDUs. The issue is that what we are seeing, mostly people who are infected with hepatitis B, are people who are at an older age, let's say more mature, that's from the ages of 20, 30, 40, 50, 60. We aren't seeing more infections among the young. The reason why is, in this country in the year 2002, most of the kids were vaccinated for hepatitis.
He talked about hepatitis C and how it is transmitted, and you are now free of it, but you were infected because you were also a drug user at some point, right? Tell us more.
About 16 years clean from heroin drug use, injection drug use, and during about 20 years ago, I was sharing a lot of needles and using needles that are not clean. So I wasn't even sure what hepatitis is or was aware about it. Though now in retrospect, I see a lot of the people I know who died while I was using drugs. I can tell from the knowledge I have now from what the professor has shared with us.
Symptoms?
Yes.
What were those symptoms?
Jaundice, swollen skin, and I think it's also due to low immunity while drugging or using, not eating properly, and you have this disease. The likelihood of progression was so much higher for us.
All right, and Dr. you touched on the fact that A and E are actually transmitted through ingestion. And just the other day we saw a school in Embu close down because they had hepatitis A. So in such a case, what measures should be put in place to ensure that you protect such a community?
Looking at the usual hygiene procedures, especially when there is one infection like that, can easily be controlled because of good hygienic practice. So issues of boiling water easily can be able to kill the virus. We have issues also of well-cooked food. And then there's also the issue of vaccination. There's also a vaccine for hepatitis A. So people who are at risk, or they find they are at risk, they can be able to have the vaccination done.
So would you encourage that schools that do mass production of food, the children should be vaccinated to just protect them from such a risk?
Yes, actually we suggest that majority of people should have vaccination for both hepatitis A and hepatitis B. I think vaccination, if it could be included as part, especially when there's this particular the occurrence of outbreaks in schools. The thing is just school authorities, the Ministry of Education and the Ministry of Health, to actually propose, and even the county governments, to propose that we should have a package for vaccination for hepatitis A, also for risk populations or in areas that are vulnerable, our children are vulnerable to it.
For you, Boniface, he's talking about vaccination. I'm sure you never underwent any of that, yeah? So you've been diagnosed with hepatitis C. What next?
In fact, I had gone to test for HIV. Fortunately for me, now that I was clean, a girlfriend of mine who knew about hepatitis C and the likelihood of people getting hepatitis C from sharing needles suggested that I do hepatitis test. So I just looked at the results and saw that my HIV was negative, and I was very happy. Then I saw a positive down there and I wasn't too sure what that was. When I looked at it, hepatitis C. What is hepatitis C? What does that mean? Then within a very short while I got really scared, because as statistics show, about 10% of the people really pass on from this. At the time, there was no medication for hepatitis C. So for about 10 years, I really lived with the disease without knowing, careful not to transmit to any new girlfriends that I had. Yeah, because I had heard that it's sexually transmitted.
Yes.
It's not easy living with something you know can kill you anytime. So we are grateful that there are some rights to medication and that it is being made available now, I'm told, through the government. But MDM was providing through certain programs they have. Now actually donate blood, you know. Something I would never do before.
Yeah, definitely good news. And yes, the, hepatitis C is curable, but there are some others that are not curable, and Daktari will tell us more about it. But also there's something else that Boniface will be telling us about, the stigma associated with living with hepatitis C. Daktari, hepatitis B seems to be recurring, especially in areas like in the North Rift region. We're talking about Baringo, parts of Eldoret. Why? What is it about these areas?
We think the issue may be much more the cultural practices that are being practiced in those particular areas, especially piercings. Some of the cultural practices we know some of the communities there may be, when they are using traditional medicines, they might be cutting, or they cut their skins, then they can be able to apply traditional medicines. They might be sharing, or they might share one piercing instrument with the other. And that may be one way of transmission. We in Cambridge, we are actually trying to be able to see what are the more risk factors which are much peculiar to that particular region, because even the prevalence rate that we are seeing is that we are seeing 8% or 10% in the northeastern, North Rift and Turkana areas than the other rest part of the country. And then again, the earlier availability of vaccines may not have reached those particular places much more than the other parts of the country.
All right, now the stigma around hepatitis is rife. Most people will not even talk about it, leave alone say they have hepatitis. Now I can only imagine living with hepatitis, how that experience was for you.
Perhaps the worst stigma is the one that we put on ourselves, self-stigma. Before I learned what I needed to learn, before I researched and asked around, I stigmatized myself. That is one, and I think that is probably worse than even what others think of you. The other kind of stigma is actually that sexual, because I've had relationships where my partners come to learn about my hepatitis C after a while of being together. So all this was very difficult after the fact. Yeah, it helps that I'm a now addictions counselor, so I've learned to really speak up and help others speak up about their issues. So I'm very comfortable with the topic. but majority of the people still suffer, and it's harder. It's so much harder when we put it at the back burner and hide it.
Professor Songok, how much of a stigma has been an impediment to treating and managing this condition?
Majority of the people or public are not aware about hepatitis itself, and especially the repercussions of getting infected with hepatitis and the support systems that are available for hepatitis. So when people don't know about that, usually there's that particular issue that it's more like HIV. So it is a problem. The other thing that you have also seen is that there is a particular policy in this all over the world currently. Drugs for hepatitis B, for management, not treatment for hepatitis B, is given to the CCCs, or what is called comprehensive care centers, which also deals with HIV. So when people have been tested and found to be positive hepatitis B and they are referred towards those centers, said, yes, I feel as if I'm HIV infected because I'm also being put together with the people with HIV. So as we put the more awareness, we shall be able to get more people coming forward and looking for support, testing, vaccination, and treatment.
I understand the vaccinations are very expensive and the treatment is also pricey. How has that also been an impediment to these addicts getting the help that they need?
Previously, the treatment was being done through a program with MDM, and we get the medication over 100 days while they supervise the training. But I hear it's now getting down to the hepatitis C, the treatment in the clinics, government clinics, that it will be available to everyone. But it's been very difficult because they had only a number of people that they want to treat, a test run, so and everyone wants to get treated, and majority of us who are injecting drug users, many of us, almost close to 90% of us, hepatitis.
Maybe just to clarify is that hepatitis C do not have a vaccine. Hepatitis C is just treatment. Hepatitis B is the one which has got a vaccine. The costs of treatment, we have drugs currently, as BONIFACE actually put, which can clear hepatitis C. Actually, it's called sustained viral SVR. 12 weeks is cleared. But then the cost of these drugs is astronomical. As you were saying, it was being asked for 1 million. That was the beginning. But though the cost has come down, it's still out of reach for population. And we have some particular small programs. It's not a national program yet, but we have some small pilot programs that are providing this particular direct antivirals to people who are infected with hepatitis C. So we are actually pushing or lobbying our authorities to see that at least they can be able to follow that way so that people can be able to get the treatment. But one of the problems also is the monitoring. The laboratory tests, not only the drugs themselves, but laboratory tests are very astronomical. They have to do the liver function test, they have to do the viral loads, they have to confirm the right now to monitor every time. Those ones are even 3 or 4 times more expensive than the drug. There's NHIF. We are actually calling, if NHIF can be able to come up and say they can use NHIF to be able to support, it will be much more better. It's a first step. Right now, people who are infected with hepatitis B or C are not covered through the NHIF unless only some particular special test.
Hepatitis can also be transmitted through tattooing. When you're doing your awareness campaigns, what are some of those obstacles that you face in even accepting that this disease can be part and parcel of any human being?
Tattooing has become very common in Westlands and upmarket areas, and it's devolving quickly. It's like fashionable. So there is a very high likelihood that we are going to get similar if these are not very well done, you know, if the tattooing is done in a way that they share needles or it can be very dicey. So creating that awareness, especially among the professionals who do that tattooing, and making sure that the people who go for it are sensitized about the likelihood of getting that kind of illness, I think it will go a long way into helping minimize. Yeah.
Okay, the spread of the same. Okay, Professor, even as we close, we have heard of discordant couples. One has it, the other doesn't. So in as far as making sure that people understand what this condition is about and what you can do to protect yourself, what would be your clarion call?
One thing is just that think about, be aware about the transmission modes, how it's being transmitted. Secondly is that go for the test. If you go for the tests, you find yourself to be positive, you can be able to prevent your partner or also yourself seek for support in terms of treatment. And then if you are negative, there is vaccination. You could be able to go for vaccination. So you might get a couple that one of them actually already had an infection but managed to clear, but then the other one could not clear. That is hepatitis B. So in that way you have that discordancy. But in that way you will not be able to know until you go for a test. So it all starts with knowing, testing, and right now seeing what you have, then see if you can be able to go to either vaccination or be referred to treatment.
Okay. Yes. All right. So hepatitis free, good news. Many others would be an encouragement to some who are living with this condition. Your clarion call?
It's worthwhile for the government to invest in vaccinations of its population, even in the very vulnerable communities, like injecting drug users. Yeah.
Okay. Gentlemen, that is Professor Elijah Songok, virologist and chief research officer at KEMRI, and of course BONIFACE NDIRANGU, who is a hepatitis C survivor. Thank you, gentlemen, for your time. It has been a conversation on hepatitis. A lot more of these conversations will be coming up even as different parts of the country wake up to the realities of hepatitis. Now, time for the health tip.
People normally rush for the treadmill thinking it's a very effective part of the weight loss program, but it's not completely 100%. The treadmill is an effective equipment which helps in losing weight, especially in calorie burning. It really do help, but you need to incorporate other workouts that assist you, like weight training, also nutrition. It's very, very important to be able to incorporate other workouts to be able to help you in losing weight and in your fitness program.
Health Bite, brought to you by National AIDS Control Council.
I want us to discuss the health-seeking behavior among men. And the first question would be, why men? It is because men have been left behind in the response, and the response, most of the response has been, I can say, been feminized. Because you realize women are involved, there are so many interventions. Most of our programs target women in terms of health seeking or in terms of care and such kind of behaviors. And this leaves men behind. Well, we know very well that men hold a lot of socioeconomic powers and such kind of issues that need to be brought into play for us to achieve much that we want. There's a notion which is there that is also true, that men have poor seeking behaviors. And this can be attributed to two factors. One is biological factors, and two is social or socio-cultural factors that come into play with the dominant negative gender norms that shapes how men behave or such kind of stuff. So in our programming, like I've been in the programming around HIV, we have seen quite a good number of programs that men have been involved and they have given results, like male involvement in elimination of mother-to-child transmission of HIV, the issues of male involvement in HTS, HIV testing and counseling services, and such kind of stuff. It's a proof that when men are fully involved and meaningfully involved and strategically understand the whole concept, then they'll be able to involve. So as we move towards UHC, I really believe that the need to strategically work with men or involve men to demystify, to deconstruct some of these socio-cultural that hinders them from seeking these behaviors. And by that, we should be able to achieve in terms of UHC, because men have powers in terms of determining even their spouses when, where and how they seek healthcare services. But in an instant where their spouses have a lot of information in terms of knowledge, or even power in terms of information or about health seeking, while men also have a lot of social power, then you might find these two powers clashing and one not supporting one another. So how do we harness, how do we work around these powers so that, and we can only achieve this if men are involved, and that will help us to achieve UHC as envisioned, or as our target in terms of the country's response.
Health Bite, brought to you by National AIDS Control Council.
Thank you for engaging us on our social media handles, Twitter, Facebook, Instagram. All your questions and suggestions, we see them. Thank you for your company. My name is Gladys Gashanja. Until next time.
Six.
Unakanika uko happy? Uko happy? The cases around the country. Too long. I need to repeat it. Distraction.